record. Okay, I think we're going.
Okay. So tell me about the area that you work in.
So I work in an adult setting. I've been in quite a few different roles since I've started. Part of that is because of COVID and our staffing changes. I've not been redeployed, but more I've been moved around in our service to kind of help out where it's needed. So I started in community and I was doing video consultations and a very occasional face-to-face where it was needed. And I was doing therapy and assessment over video, which was really new and different. And from that, I went to neuro rehab as well. So there are, I think there's 16 beds, and we provide speech therapy to the neuro patients that come in that need it. So you're seeing TBI, stroke, lots of different progressive things as well in there. And I've just started as well on the stroke ward. So that's new, it's more fast paced, but I'm really enjoying it, and lots of dysphagia on the stroke ward as well. And I do one day in acute as well for my dysphagia training. So I've got a bit of everything, which is really good for a first post.
Yeah, there's lots of variety there.
Yeah.
That's great. Cool. Okay, so the first question is, did you personally feel nervous or unprepared in relation to assessment and treatment of dysphagia?
Yes, I was definitely nervous when I first started my job, because I had not had an adult placement for quite a few years. So I was a bit kind of feeling out of practice. But I think the dysphagia course at university, it does kind of prepare you, as in it covers all your kind of basic dysphagia knowledge, and things like your bedside examination, which is really important, your cranial nerve assessment, and just having awareness of these things, and also your compensatory and rehabilitation strategies. Because you're going into your first role not dysphagia trained, and they know that. So you're not expected to come in and start practicing and know everything. But as long as you've remembered your dysphagia course at uni and you're aware of all the different assessments and strategies, then I think you can feel prepared as much as you can before you start your dysphagia competencies, and you'll kind of build on your knowledge from there. Yeah.
Cool. Okay, so next question. How did COVID-19 impact your assessment and intervention procedures?
So when you sent me this question, I was kind of trying to think about the impact of COVID and the different kinds of impacts it's had, because we have on the wards, we're seeing patients who have got dysphagia from COVID. So that's more your kind of maybe intubated patients, or other reasons why they've got it from COVID. So there was that caseload, but there's also another kind of impact for people that maybe don't have COVID, and that's putting on your PPE. So it takes more time before you go in to see someone. You have to doff and don, and it's the first time you do that. It takes a while because there's an order you have to do it in, and you have to really think about it. Also, it kind of impacts your assessments a bit in the way you have to think about as well what you take in. Because when I first started, I wanted to take in my sheets and my notebook to remember what I was doing and what I was going to do next. And when COVID hit, obviously I couldn't take in, we weren't meant to take in anything really, as little as possible. So what I did take in had to be wipeable. And I had to kind of think on my feet and remember what I'd seen in my head and put that in the notes when I came out. So it changed practice a bit that way for me. And also I found when I'm doing cranial nerve exams in dysphagia, with cognitive, maybe patients who are cognitively impaired, it helps for them to have a model when you're doing, can you open your mouth? And when you've got a mask and a visor on, that model's not there for them. So again, it's thinking like, what can I do to try and get around that? So taking in a nice wipeable laminated picture of people doing the different oral motor movements, and that was really helpful. So it's impacted us in lots of different ways in dysphagia. And also there's still that ongoing debate about whether dysphagia is an aerosol generating procedure, and we're still fighting. Luckily in our trust, we have full FFP3 when we go in, and they do recognise, but I know not everyone is as lucky as us.
Yeah. Is there anything else that you do to kind of encourage them, doing those cranial nerve tests?
Sometimes I'll try and use almost like cued articulation. So I'll say, can you give me ah? And for your E, I would maybe say smile. And for your eyebrow movements, I would maybe say, can you look shocked? Like, and try and, as best as you can, try and kind of and do the sounds and the movements just to try and encourage. Sometimes you need that with your pictures as well. But sometimes it's just not possible to do the cranial nerve if they can't follow the instructions. So then you have to think about other ways you can see the cranial nerves in action, maybe during your oral trials, and just to try and get as much information about their swallow as possible.
Yeah. What does a day of dysphagia look like in practice?
So I'll give you an example from the stroke ward, because that's where I've done most of my dysphagia. So normally when I come in the morning, I start at 8 and come in, just kind of get laptop set up, and then we go to board round, and that's like an MDT meeting with our OTs, physios, and therapy assistants, and we go through all the patients in the ward, and we go through kind of their diagnosis, their current medical status, what our goals are for them while they're in hospital, and discharge planning as well. So that happens every morning, and that's kind of almost like a triage bit as well. You can get information on people, and you find out about new patients that have been admitted. So once you've finished your board round, you'll come back and you'll have an updated list of all your patients. So speech therapy have got their separate list of everyone that needs to be seen for speech, and normally kind of band 6s and will help us prioritise the list and delegate. So at the minute I would maybe see about 3 communication patients, maybe 4, depending on how fast I am, and what else I need to do if there's any meetings. So then once I have my list of patients, I'll prep for each one. What do I need to take in? Also, what PPE do I need? And then go and do your assessments. Once you come out, if your patient was nil by mouth and you think, yep, they're ready, maybe ready to start oral trials, you speak to the medical team, and that's a decision with them. So you have to kind of hand over and discuss with them. If you're upgrading anyone's diet, you need to make sure you're telling the relevant people, for example, the housekeeper who might do meals for that patient. So make sure they've got the right modified texture meal. Then you'd probably write up your notes. And then once I just do that for all my patients in that day. So it's good, it's fast paced, and you're taking case histories, and you do need to kind of think on your feet, but it's good. Once you get it, it feels really good, to be part of that process and being able to work as a team.
Yeah. I imagine it can be quite challenging getting into that routine, but when you get it, if that makes sense.
Yeah, and I was nervous when I started. I thought, when I moved from my nice community setting and my neuro rehab, and I'd just gotten to grips with everything, and then I went straight into stroke, and I thought, but everyone there wants to, they want to see you do well, and they're there to support you and help. You can ask anyone a question if you don't know where stuff is or where things are. So it's a fun environment to work in. I really enjoy it.
That's really good.
Yeah,
sounds really supportive as well, which is good.
Yes, yeah, it is. It's really good. And as well, when you're on a stroke ward, there are going to be other SLTs about. So I'm doing my competencies just now, so I'm not seeing people by myself, but if I was, there's other SLTs where I can bounce ideas off or ask for help if I need it. Yeah.
Has COVID-19 had an impact in your competency training at all?
For me personally, it's not had an impact. Even though, COVID-19 has kind of changed things up, we're still seeing dysphagia patients. So there's still that opportunity for me to go and do my competencies with other staff. Because at level 1, you start with observations. So I've still been able to do that. I wear my PPE when I go in, which, I'm still doing mine just as normal. So I think if you were worried about that applying for a job, if you thought maybe, will I get my competencies because of COVID? If you just ask them that question in your interview, do they have an in-house training program that you can go by, or how does it work, and just get a feel for what it is in that trust that you're applying to. Yeah.
Okay, that's great. So the next question is, how long did it take you to feel confident with the competencies? This dysphagia is quite scary.
I like that last bit. Dysphagia is quite scary, but again, your competencies are designed to kind of ease you in, so don't feel too scared. I'm doing I think it's the same for the RCSLT, but we've got an in-house training program which is taken from the RCSLT, but just slightly tweaked. But we do levels, so level 1 to 4, and level 1 is just observing, and kind of theory-based stuff as well. So when I started, I was just kind of watching and observing, taking over when I felt confident enough to, and it's quite a natural progression from observing to getting more hands-on. And I think once you finish your level 1, you feel, right, okay, I want to have a shot now. So although it's scary, it's quite a confidence boosting way, the way the competencies work, because it's a nice kind of natural flow up from watching to getting hands-on. So yeah, don't be scared. It's good fun.
I think it's great that they've broken it down into levels as well then. Like, so you do go from observer to, you almost get the opportunity to dip a toe in, as it were.
Definitely. And as well, it's not just about the assessment, it's also about kind of handing over to doctors and having the conversations with family and like risk feeding things, and it's all kind of incremental, like, okay, you've done your cranial nerve, you've done your oral trials, now you're going to try this on top of it, and you're going to watch first and then you're going to have a go. So it's a really good way of learning your dysphagia. Yeah.
Oh, that's really good. And as a side question to that then, what level are you currently at in your competency?
So I've just finished 1, and I'm now in 2. But again, I felt towards the end of my 1, I was ready to start 2 and get a bit more hands-on, and that, it feels good to have moved up a level. And I've had my dysphagia theory training as well, which is good. And that's pretty similar to kind of your uni course. It's just going through, the aging swallow and all the different things that come with it. So yeah, it's good. It's nice and comprehensive.
That's good. And it kind of builds on the theory that we have gone through at uni.
Definitely, yeah. It's that course that you get at uni is like your foundation. And I've found a lot of times that I've thought back to my dysphagia course and that's what she was talking about. And it's nice to see things that you learn about actually happen and in practice, and you see it and you can link it back. And I'm afraid to say never stop doing your reflections. They're ongoing in work, but they're really useful as well.
I guess actually you're getting to do it in real time as well, though. So actually they're more worthwhile in that sense. You're actually integrating it into actual clinical practice rather than a case study or something like that. So actually I'm sure it's not kind of another. It's
less of a chore, if I can call it that, but it's more. Yeah, like actually I want to reflect on this and why did I feel this way and what am I going to do next time? And it does, I feel like I'm narrating my reflection essay, and it does help you as like a practitioner to kind of build on your experiences and learn from them.
Yeah, I definitely experienced that as a speech therapy assistant as well, because I was quite often asked to reflect on the things that I did. And reflecting in actual practice is very different to the experience that you get at uni, actually.
But it's good to do at uni, because if I hadn't done it, if I hadn't learned, then I would have been a bit stumped when I first what's reflective practice? It's good to do at uni.
Yeah, definitely. Excellent. Okay, I'll go on to the next question. So the next question is, how important is oral care for patients?
So oral care is very important for everyone, aside from dysphagia patients, but especially for your nil by mouth patients. So even though they are, you've stopped their oral intake because of aspiration, you're worried about aspiration, they are still swallowing saliva, and there's still a risk of aspirating their saliva. So one of the big things about oral care is making sure they have a nice clean mouth, because that build-up of bacteria, because they're not eating and drinking, they've not got that natural kind of balance of bacteria in the mouth. So with the oral care, you can try and prevent that nasty bacteria build-up, which could then be aspirated into the lungs, and it's not going to be good. So the more oral care you can do, you can keep those nice bacteria in the mouth and stop them from aspirating anything nasty. And also just from patient comfort. I mean, have you ever woken up with a really dry mouth? Imagine having that all the time, and it looks uncomfortable. I've seen a couple of dry mouths and cracked tongues, and it looks, the patient sees the drink when you go into the trial and is saying yes, and there really needs to have more regular oral care to keep it nice and pink and moist. That's the perfect mouth.
Yeah.
Oh, and I was going to say, actually, sorry, there's a nice oral health assessment tool, and it's on the NICE guidelines. I think it's an Australian one that they've got up, but it's called, if you look up NICE guidelines and oral health assessment tool, you should be able to find it. But I can send you the link as well. You can put it up somewhere for people to access, but it just gives you a nice what to look for, and other links and information.
Oh, fantastic, thank you. Is it your responsibility as a speech and language therapist to maintain oral care, or are you recommending to staff on wards to kind of keep up with that? I mean, is it a shared responsibility? How?
I think it's kind of, yeah, everyone's responsibility to make sure that, you know, if you see a mouth that doesn't look comfortable or looks, you know, unhealthy, then to say, especially it's the nursing staff who would kind of implement that oral health plan, and they would do the regular oral cleaning, but we could definitely liaise with them to start up an oral health care plan for the patient. Yeah.
Excellent. And just as a side note, is it the pink sponges that you use, or is there something else that you're using on your wall? Because I know it varies from trust to trust.
It does vary, and I know that people are not big fans of the pink sponges because of the risk of that sponge coming off and going places it shouldn't. But we do use the pink sponges just now. I've seen a couple of different types of things to use for the oral health, but yeah, we use the pink sponges just now. But as long as you're, you know, there while you're doing it, or, you know, putting it away from the patient when it goes down and a safe distance away, you know, one in, one out, making sure it all comes out.
Yeah.
Yeah.
Okay, so last question. If you could visit yourself as a QMU student, is there any advice that you would give to yourself? Anything you'd wish that you'd felt you'd been a bit more prepared for, or even worried less about as a student?
Yeah, I think this is a good question, actually. So well done, whoever asked it. But I think one of my top ones, and this is me, is worry less, because I was a big worrier, especially in fourth year, and especially around getting a job, because I was kind of the mentality that, right, second semester, fourth year, apply for jobs, get a job as soon as I can, and, you know, that'll be me. And now I'm very pleased that I got a job, but I'm glad that I didn't throw myself at the first thing that came up, because I really like the post I'm in now for the field and also location, and I kind of waited a little bit and held back and didn't just fling myself at the first opportunity, although it's so tempting to, because it's like that panic of I need a job, and actually just see what's out there and take your time, don't stress, enjoy your last ever big holiday before you start work and your holidays ago. Yeah, so definitely worry less. And also, I mean, I'm thinking about dysphagia because obviously, you know, that's what we're talking about today. But just go through, if you're worried about dysphagia, you know, go through your slides from uni and just ask questions. I think one of the things that I've learned from working is, if something doesn't feel right, don't just do it. Just wait and go and ask someone and just double check, because it's just not worth taking a chance. And I mean, people, you know, normally have quite a good gut instinct. You know, if you're just not quite sure, just double check with someone else. Yeah, and also I probably would have used Pebble Pad more, because reflections, although, you know, it is difficult to get them going and get it started, but when it comes to applying for jobs, if you have put in that effort and you've got your selection of reflections to choose from, it will make your life easier. I mean, you can still, you know, create a bank after, but it's just a lot more work. Whereas if you're doing it throughout, you're going to have a much bigger range to choose from. So yeah, can't believe I'm saying it, but do your reflections. And yeah, I mean, do you want to know more as in interview wise, or just dysphagia as a whole?
I mean, either. If you have some good advice for either, that would be fantastic.
I think the RCSLT Student Day is a really good thing to attend if you're able to. I'm not sure what they did this year, because obviously it might have had to be virtual. But if you can, I know that the uni sometimes circulates tickets for it. We get allocated a certain number, although just double check that. But yeah, my group of friends, we all went down to it and we found it really useful to get that ball rolling about jobs and interviews, interview tips, and just meeting the RCSLT committee as well was nice, you know, put a face to the names that you see on emails and bulletins. I thought that was really useful. And the other thing that I think is I stressed a lot about what mark I was going to get in my degree. And I think you should definitely care about what you get. I mean, everyone's different, but when I did all my interviews for jobs, it was more, have you got a degree than what did you get? I mean, I can't speak for everyone, but it was more of a SLT degree, tick, and what experience do you have in life? So, and I think that's what separates you from other candidates is, you know, where have you worked in the field before? You know, show me your enthusiasm for this, and why should I hire you? And I think being in the SLT Society is definitely a big, you know, plus. You can talk about loads of different experiences and that you've had with the society, and I know you guys have done the Macathon Monday.
Yeah.
And yeah, just like seeing everyone taking part in that is so nice. It's just getting involved in things like that. You know, they want you to become part of the team, and they want you to see you getting involved and wanting to become part of the team, and doing things like that shows, yeah, you know, you've been part of the SLT team at QMU, so definitely a big plus to speak about in your interviews. Yeah. One of my interview questions was, tell us about a time that you introduced an idea to a group of people or a team or something, and how did you go about introducing it, and how did you deal with compromise? And I used an example from SLT Society because we had done obviously our swallowing awareness and I just talked about kind of bringing forward ideas to the committee and kind of taking bits of everyone's ideas to make it better and playing on people's strengths, and I just thought that was a nice example that fitted in well. And there's loads of other things. I mean, I always mentioned swallowing awareness in my interviews and what we had done as the committee, because I think, you know, it's humorous as well to put in that you got a shout out from RCSLT. Hashtag famous. But yeah, it's just, I think it just shows that you're willing to put in a bit extra. You know, you haven't just done the bare minimum of a degree and that's you've actively sought out things to, you know, to get involved in, and I think that's important to show in an interview, and can be that separates you from someone else. Yeah, I mean, I think the degree is a massive part of it, and you need to have a degree to get a job, but I'm just in favour of the life experiences. So I volunteered for Chest, Heart, Stroke Scotland as well, and I worked with adults, and I just think as employers those experiences are invaluable, and that's what they're looking for, as well as a degree obviously, but it's good to have those things under your belt to make you stand out, definitely. But as well, this is personal experience, but with that first interview, I was shaking. I was so nervous. I tried not to show it, and I didn't get the job, and I cried after. You know, I was heartbroken as I'm never going to get a job. But, you know, something better came along. So, you know, I think that first rejection is the hardest. And it's okay to have a cry, but there's always something better around the corner. Yeah. But
it is also important to keep in mind that if you don't get the job at the first interview, you know, you're not failing at the first hurdle. You know,
no,
you're going to be up against a lot of other, you know,
and
in the same boat.
Yeah, you're competing against all the other band fives that you know want to get a job as well, and sometimes you're competing against people that have already been working that want to change fields. So, you know, don't beat yourself up if you don't get your first job, and always ask if you can get any feedback, if they're willing to give you any feedback after the interview. And they want you to do well as well. You know, they're not there to interrogate you. But yeah, interviews are scary, but once you've done a couple, you'll get into the swing of it.
Yeah, you find your feet.
Yeah.
You know the sort of questions that they're going to be asking you as well. So I guess you feel a bit more prepared in that respect as well.
Yeah, there's a theme. There's definitely a theme that goes around interviews, and you know, tell me your best qualities, and tell me about a time that was difficult and what did you do to get through it. You know, these ones are always coming up. Good to have under your belt.
Yeah, definitely. Excellent. Thank you so much, Jillian.
No problem.
This has been really, really fantastic. It's really good to get an insight into you know, a QMU alumni as well, you know, getting some perspective and, you know, seeing you flourish in your first year as a newly qualified speech and language therapist.
Yeah, I still
also
can't
doing
believe it.
I know, but also like doing it in a really, you know, a really intense year to become qualified. You know.
Yeah, it is intense, and it's funny because this is all I know, and colleagues will say to me, you know, this is so different for all of us, and you know, it's not what it was like before and when we practice. So yeah, this is the new normal for me. See, it'll be again new if we kind of get back hopefully soon to that normal kind of time where we can actually see people face to face. I can't really imagine doing a session without wearing a mask and an apron and gloves. That'll be a really strange time when I do that.
Yeah, I bet you suddenly feel very exposed all of a sudden.
Yeah, definitely. Yeah. But we'll take it in our stride.
Yeah, definitely. Thank you so much, Jillian, for joining us and for answering the questions. It's been really great.
Thank you for having me. It's been lovely to see you again, and good luck with all your swallowing awareness activities. I can't wait to see them.
Thank you very much. All right then.
Bye.